Hey there, Dimitri from Total Physical Therapy, total-pt.com. In the last video, Tim addressed a very common fault in the general movement, which is the squat. And what he talked about was how the pelvis kind of dumps out posteriorly. So if you go through a squat and you go down, normally you have to have adequate length of certain muscle groups in the hip, and if they're tight, what occurs is you go down, and then at a certain level, you kind of round out or hollow out the back, instead of keeping it nice and flat. Okay, so this is a neutral spine position where your spine is on a straight line. If there's a fault, your pelvis will 99 out of 100 times posteriorly tilt this way. So there are three main muscle groups that have a length issue if that is the case. And almost everyone does have this problem if that occurs. One would be hamstring tightness or lack of adequate hamstring length. Second would be a length issue of the gluteal muscles or the glutes. And third would be a length issue or a shortening of the adductor or groin muscles. Okay? The hamstring muscles attach from the sit bone or the ischial tuberosity and go down and cross the knee. So what I tell folks is that if you have a string that goes from below the knee and attaches here, as you squat down, that string lengthens. So if you have, so if that string gets short, it's going to pull your pelvis posteriorly. So as you get down and that string reaches its end, it's going to pull your pelvis posteriorly and it's going to dump you out here, instead of having an adequate length and control and keeping those hips back. All right? So that's the hamstring control. The glutes are the same thing, but instead of the string going from the sit bone to the knee, the string is going from the top of the pelvis and attaches into the greater trochanter right here. So here's that same string, and if that string lengthens adequately as you squat, you're going to have plenty of real estate for that hip to go down. But again, if you take that string and now you shorten it, as you go down, that string is going to reach its end, and then again you're going to tilt posteriorly. Okay? So that's the length issue when it comes to the glutes. Third is the adductors. So the adductors are almost the same as the hamstrings. They're just a little bit more internal or on the inner thigh. And they're attaching the same areas. They're just a bit more on the medial aspect of the sit bone or the ischial tuberosity, and also on the medial border of the thigh. So again, if you're squatting down and you go down and that length is compromised, it's going to pull those hips posteriorly and then give you a rounding out effect. All right? So again, what does that lead to? It leads to obviously hip pain, obviously back pain, and obviously all those muscle groups that are at fault can result in strain. So you're going to have pain in the hamstrings, in the groin, or the adductors, or obviously in the lower back. And the lower back could be disc herniations, muscle spasm, stiffness, loss of mobility, and obviously loss of strength and control. All right? So those three muscle groups, when they have length compromised, you're going to see a normal squat turn into a squat and a posterior tilt. And unfortunately, obviously, if you load weight on top of that, everything just gets magnified. All right? So in the next video, we'll show you how we can address those length issues with simple little drills to work on flexibility as well as control. All right? See you next time.